Service Award.
As long as you're ready to defend yourself before Honorable Yon, so then we shall give.
He has given a go-ahead. Right Honorable Speaker, allow me first of all to start by thanking this Parliament for appreciating the work we do, but also for the support that they give to the health sector. Over the years since the year 2000, when we had the first Ebola outbreak, we have been building systems. So I want to allay anxiety. All these things you are worried about are in place. That is why we were able to detect the 2 cases in real time. Otherwise, if we didn't have systems, right, Honorable Speaker, we wouldn't have detected. In addition to the quick detection, we have built very strong laboratory systems, surveillance systems, risk communication systems, and we are moving. And one of the issues why we did not come out at that time to declare an outbreak of monkeypox, we said we are just out of Ebola. We are just out of COVID. We come and make another declaration. So we just said we have cases. And one most fundamental issue was not to disrupt trade among the population and to cause scare. And we don't want you to be scared. We are handling the cases. I actually, during an engagement with members of Parliament, wanted to meet the members of Parliament of Kasese, but they were in a hurry. We wanted to bring it to their attention and just allay anxiety, because the country must move on and trade must move on. Uganda is signatory to the international health regulations, and whenever there are outbreaks, we do not restrict movements. We don't. We have what we call port health. Port health is a system where we carry out routine, it is part of our health system, surveillance at the border points of entry. The people of Kasese will testify there are screens there, there are people, there are computers, there are vaccines at the border posts of entry. And many others, Malaba, Wea, they are all there. So please let your anxiety cool. The Ministry of Health is in control. Right Honorable, availability of vaccines. You know, once an outbreak is declared a public health emergency of international concern, the entire international community starts mobilizing resources, including vaccines. So even the production of vaccines will go up, but it may not be adequate to cover everybody. So they will start with most at-risk areas. And that is the importance of declaring a FEC whenever there is an outbreak. So the limited availability of vaccines will be addressed. However, in my statement, I did not say that vaccines are under development, as alluded to by Honorable Otala. I said they are awaiting licensure. The research was concluded long ago. The development was concluded. The one of the US is waiting approval, and then the rest of the vaccines are waiting licensure. And immediately that discussion is concluded, the vaccine production will go up. Coordination between African countries. We have the African CDC that coordinates us, and in my statement I clearly said it was the African CDC that announced first a continental emergency, and the continental emergency was referring to the African continent, that there is an emergency, and they are coordinating us. However, specifically within East Africa, we also have our East African CDC that is headquartered in Kenya, and it also brings on board the East African countries together. We have our fora where we sit and discuss, and in the next 1 week or so, we shall be in Congo Brazzaville to discuss. So the coordination is ongoing. Now, the border point at Orom and the kidney failure. Right Honorable Speaker, we are sitting on a time bomb of non-communicable diseases, a time bomb. 25% of our population has high blood pressure. It is not related to the outbreaks or the vaccines. It is related to our lifestyles. And it is something that we must handle urgently. We are preparing documentation on that, including banning unsaturated fats. You see this business of people eating fried things on the roadside, chips, whatever, Blue Bandy, you know, those things, they use the same oil over and over and over. We are at risk. And the young people are now most at risk. And that is why he's seeing cases, but he's thinking it is due to the outbreaks. No, it is our lifestyle. We need to address it, including other non-communicable diseases. Right Honorable Speaker, I don't want us to worry about village health teams and community and information. It is already with them, and they are doing what is needed. Hastening approval of the vaccines, it is ongoing by WHO. The issue of eating monkeys and so on, Right Honorable, I don't know the communities that eat them. We've talked about these things. I think we need to continue to educate our people. How long does the virus stay on contaminated surfaces? Right Honorable Speaker, for monkeypox, actually the time period is longer. The virus can survive for up to 15 days under optimal conditions. 15. And that is why in my statement I emphasized avoid sharing clothes and so on. But on hard surfaces, between 24 to 48 hours, that is why we must encourage cleaning with sanitizer and making sure that we wash our hands. The Ministry of Health works through what we call a One Health approach for the purpose of the veterinary doctor. A One Health approach brings on board Ministry of Health, MAIF, Wildlife, Water and Environment. And that is how we handle outbreaks, through a One Health approach. The complications of the vaccines and in regards to erectile dysfunction, my chair emeritus will discuss that in details with the men. But for now, I want to reassure you that the vaccines are safe. Chair, the issue of disinformation and misinformation, we have already started addressing. And I started addressing this when I requested you to give me members of parliament. I have been talking to them about vaccines. We are engaging other groups before we go full blast to the communities. But honorable members, Uganda has only 14 vaccines, 13. The malaria vaccine will be the 14 on our routine schedules. Some of those countries like the US and where have 54 plus vaccines. What is our problem? The vaccines have kept us alive and well. We eradicated polio. You're no longer seeing people with lame legs. We have eradicated many diseases. We are in the process of eradicating. Can I continue talking? And many others. So when I see people saying we have too many vaccines, I even wonder, you have too few. If we had many, even the issue of flu and whatever, you would not be experiencing. So don't worry about these vaccines. They are good. They are cheap. They prolong our lives. Instead of bringing in family planning and so on, if we had more vaccines and children were living longer, you would have women having fewer children. So let's embrace vaccines when they come, instead of giving negative information to people about the vaccines. I will not answer for Ministry of Science. I think we can invite Ministry of Science to come here. Right Honorable Speaker, I want to conclude. The issue of mandatory hand washing, contact, handshaking, all those things are in the Public Health Act. The challenge is enforcement. When we started hand washing during COVID, everybody participated. All these diseases went down. Now it has risen. Lastly, on the issue of resources, Right, Honorable Speaker, I have requested over and over again whether we can have a budget that is ring-fenced for epidemics. I have never gotten that. Now, whenever I get an epidemic, I mobilize partners and I go into mobilizing resources. It is really hard. I need to be supported in that area. I thank you.
Thank you. Now, Honorable Jomo.
Thank you very much, Right Honorable Speaker. I just wanted to make a brief comment before the Minister rose.
Honorable, we don't have much time. I want us to handle this statement before PM time.
Just two comments that as a Ministry for Information, we are working and we are going to continue working with the Ministry of Health to intensify the campaign. And maybe I request the Minister of Health that their health education materials which have been developed, we could produce more copies for members of parliament so that members of parliament, especially from the 17 districts which border DRC, can be part of the mobilization to educate the masses. Then second and lastly, just to reassure the honorable members that the process of vaccine development is so rigorous that there should be no fear among the members about vaccines, because vaccines go through a process of preclinical and clinical trials, and then WHO has to go through approvals, checking efficacy and the effectiveness and safety. So we would want to request members of parliament not to fear vaccines, because by the time Ministry of Health says we have approved this vaccine, it has gone through lots of trials. The Speaker says there is no time. So I just wanted to reassure members that the vaccines that we use are safe and efficacious.
Thank you.
I thank you very much.
Yeah. Honorable Minister for Tourism, it seems.
Honorable Speaker, and indeed when Dr. Bwanika was making a presentation, because fact is, interaction with this wildlife does not bring disease. We've lived, it's just like interacting with any other animal, a dog, and the cats that we love. So, Right Honorable Speaker, usually it is as a result, just a minute. Usually it is as a result of eating. Yes, we have people who have been visiting. Yes, it is.
Honorable Minister for Tourism, can you go and agree on it with the Minister for Health? Okay?
Yes.
And we get good guidance, because otherwise we are going to have, you know.
But